Welcome to Research Debrief, the podcast that bridges the gap between the fitness industry and the latest science. Luke, what research are we diving into today?
Rachel, we're going to look at what I think is one of the most important, so I'm going to say top 3 most important papers published, not just in 2026, but over the last few years for our industry. The paper is titled Optimizing Weight Loss in the GLP-1 Era, Preserving Muscle Mass, Function, and Metabolic Health through Precision Nutrition and Resistance Training. This is a 52-page paper that was published just a matter of a few weeks ago, and it is now the blueprint for how we're thinking about weight loss. And specifically, the paper is probably written for our primary care physicians. This is what's going to guide that physician and how they interact with patients. But as the health club community, as exercise providers, we need to understand what is top of mind, what is the physician, what is our healthcare practitioners, what are they thinking about, so that we can come alongside them as a wonderful partner. And we're going to find out there's so many takeaways from this paper absolutely position us to be really, really effective with this population.
Yeah, very cool. All right, well, I'm excited to hear more.
All right, well, let's jump into it. I have a few key takeaways. The first key takeaway is that GLP-1s have just fundamentally changed the weight loss business. And I know this is not breaking news for anyone listening to this podcast. So we're in this era where substantial weight loss is possible without surgery and at a scale that was not previously achievable through kind of lifestyle interventions. The reason this whole paper is important is that we just weren't good at weight loss prior to GLP-1s. Frankly, physicians are in a whole new world because when they told a patient what to do around lifestyle interventions, they didn't lose very much weight. When we're losing 50 pounds or 60 pounds, it is just a very, very, very different scenario. So we probably need to change the fitness industry's value proposition around this. Instead of saying things like exercise to lose weight, we need to change that message, because that's just not a compelling message, because people are losing weight via GLP-1. So I think the new question, and this paper does a good job of articulating this, the new question that the paper really poses is, how do we help people lose weight? How do we help people become healthier, more physically capable while they lose weight? So this GLP-1 may force our industry to stop selling weight loss and start selling what exercise is uniquely good at. I think this is a really positive message for us, because the dirty little secret on all of the exercise science research around weight loss is exercise is just not very helpful for weight loss. So if our industry was banking on that, man, good luck. It's tough. But it turns out that exercise is really good at a host of other benefits, and that's probably where we should shift. So that's our first key takeaway, and I know that we all kind of understand that the GLP-1s are changing the game. The second is that the scale is becoming a less adequate measure of success. So one of the key takeaways from this paper is what they call healthy weight loss. And part of the idea of this kind of healthy weight loss is, well, what are you actually losing, right? A pound lost is not a pound lost. Your body weight only tells you that you lose body weight. It doesn't tell you much about, is it fat, is it skeletal muscle, is it body water, is it other tissue? So the terminology they use is high quality weight loss. We're going to hear every physician, we're going to hear every component of the allied healthcare continuum talk about high quality weight loss. We want to lose pathogenic adiposity, meaning we want to lose the tissue that is causing chronic disease while preserving muscle strength, physical function, and of course nutritional adequacy. So one of the things that we're learning is the GLP-1 decreases our caloric intake. We're eating less food. That's why we're losing weight. That makes sense. But we might not be receiving the nutrition that we need to receive. So that's kind of the nutritional component. And we'll jump into that. So maybe the key takeaway here for operators is we're just not going to talk about how much weight did we lose. The conversation is going to be, how much stronger are you? How much muscle did you preserve? How has your physical function improved? Because this is what our primary care physicians are talking about. They're going to look at this weight loss paradigm as, well, how much fat did you lose? Did you retain muscle? Did you retain strength? And are you getting the micronutrients and the macronutrients that you need now that you're consuming less food? That's where the whole focus is going to go. Now, this becomes different for different populations. right? Telling someone to get on a GLP-1 drug and they're losing weight when they're 60 years old, there's a risk there because that 60-year-old probably is not starting with very much lean muscle tissue. 40-year-old on a GLP-1, they're starting with more lean muscle tissue. So when we think about what are we losing and can you afford to lose muscle, it's different for different populations, right? And I just went to age populations, but different populations as a whole. Are you previously sedentary? Have you been engaged in resistance training? So that's our second big takeaway, is the scale is just not reliable. And again, I think fitness people have always kind of been aware of that. But what this paper is saying is our primary care physicians need to stop talking about weight loss and start talking about this paradigm of high quality weight loss. I think our third big takeaway is that muscle preservation becomes one of the industry's most important jobs, right? That's the language we're going to use, is we are in the business of muscle preservation. And of course, all of our health clubs and our studios and the fitness concepts that currently exist, we're well positioned for this. So the authors talk about the importance of strength training or resistance exercise as the primary non-pharmacological countermeasure to combat the loss of lean muscle when we are on an energy restriction diet. And of course, a GLP-1 causes energy restriction. So resistance training can help preserve lean tissue and of course also improve strength while we are losing body weight. So that's a key take-home message. Resistance training doesn't necessarily make someone lose more weight, but it makes the weight they lose better, right? That's the key takeaway. We don't strength train to lose weight. We strength train, we're already losing weight because of the GLP-1. We're maintaining or retaining as much lean muscle tissue as possible. Now, I think the fourth key takeaway from these researchers, and this is really positive for our industry, is that GLP-1s definitely don't replace exercise. We just don't need to be worried about that. They potentially make exercise more important. And the potentially is really the words from the paper. I think they definitely make exercise more important. The medications, GLP-1s, reduce appetite and food intake. That's how they work. That's precisely what makes them effective, of course. But it can also create this nutritional vulnerability, right? We're not getting the adequate protein. We're not getting adequate energy intake as a whole. We're not getting the right micronutrients and macronutrients as a whole. So we need to be aware of that. The exercise interventions that we're using, they're just kind of doing a different job now. We're not exercising to try to stimulate weight loss. We're trying to preserve as much lean muscle tissue as possible. The GLP-1s create the energy deficit. The resistance training, the strength training we're doing, provides the mechanical stimulus to preserve our muscle and our function. They're different, but they're both incredibly important. And then the nutrition provides the raw materials to support that muscle. So we're always going to think about it in three ways. The GLP-1 is for the weight loss. The resistance training is to add muscle, keep muscle, and make sure we can function. And number three, really be dialed in on, are we getting enough protein? Are we getting the macronutrients? So that's the nutritional component. So we have to just think about this as an ecosystem and not just, hey, take the medication and lose the weight. And this is evolving quickly, right? GLP-1s, I think, have been really popular for about 2 years. And what this paper, what the authors of the paper are saying is, as physicians, we have to just have a more holistic conversation. I think the next big takeaway from this paper is this creates a pretty good opportunity for operators who can position themselves as, hey, we provide strength training and we provide supervised strength training. So the paper is very clear that we cannot tell our people to engage in exercise. We can't take exercise as kind of one thing, right? Instead, it needs to be, well, you have to do this type of exercise. We do aerobic exercise and cardio, of course, for cardiovascular disease, risk mitigation, and we're aware of that. But we can't just say, you got to come to the club to exercise. And we're not, as a club, we should not say, we're here to help you exercise. What this paper says is we need clubs, we need practitioners somewhere that can help people do supervised resistance exercise, because that is what the patient needs. So if I'm reading this paper and I'm a club operator, I'm thinking, okay, we're no longer a destination for exercise. We're a destination for supervised resistance exercise. And the beauty of it is there's so many different ways we can provide supervision. Large group and small group and one-on-one, and making our strength training floors more approachable for the average member. But what they say is We have to talk about resistance training instead of just exercise as a whole. And the resistance training should probably involve some supervision, appropriate exercise selection, progressive overload, which means we have to increase the stimulus over time. There should probably be some accountability. There should be modifications for individuals that have different limitations. We've said this for years that practitioners, healthcare practitioners, physicians have recommended strength training to people who are largely pretty healthy. But if I'm 62 years old and I'm on a GLP-1 drug, I might have multiple other health complications. So we need to have expertise around working around these limitations. And then ultimately we need consistency. So the value going forward is not, do we have access to strength training equipment? The value is, can we get someone to do effective resistance training? And this is a massive commercial opportunity because most of our clubs right now offer strength training equipment, dumbbells, free weights, but we don't have a way to get people to actually resistance exercise consistently. So we have a wonderful market opportunity here. And then lastly, we need to measure the outcomes that actually matter. So this is, are we not just losing weight, but are we losing fat? Are we increasing our muscle strength? Are we at least maintaining our lean muscle tissue? It's okay to lose some muscle tissue because if you lose 50 pounds of weight as a whole, we should lose some muscle tissue. We want to try to maintain or retain as much muscle tissue as possible. And how much we need to retain is probably going to be a little bit different based on our age and how much muscle we had to start off with. So if I had to kind of summarize the importance of this article for our industry, I would just say, we have a wonderful opportunity to redefine what our industry is actually selling. The GLP-1, I don't want to say craze, and I don't want to say fad because it's not a fad. The GLP-1 era changes the role of our industry. So this is a revolution that I think positions us well to provide unique value to our customer.
Yeah, and very valuable to understand what the science and data and research is saying towards physicians so that we as health clubs can complement that kind of insight and positioning, because the term high quality weight loss was new to me. So if you as a health club operator understand that that's something that physicians are saying, you can then reinforce that with your gym members that happen to be on GLP-1s, and it makes you look like you're working cohesively with the medical community instead of flying in the face of it.
Couldn't agree more. And there's so many examples of that, Rachel, right? If a new member comes in and they have spoke with their physician about a GLP-1 drug, and the physician has read this paper, and the physician understands GLP-1 drugs are effective, and we as health club operators or our fitness staff are speaking negatively about GLP-1s in any way, shape, or form, we are going to have a tough time resonating with those customers on a GLP-1. And frankly, more and more, a higher and higher percentage of our customer is going to be on a GLP-1, or at least communicating with their physicians about it. So I think there is a wonderful opportunity for our health club leadership to get with the entire fitness team and say, this is how we communicate around GLP-1 usage, because this is what the physicians are talking with patients around.
Exactly.